My name is Haley Edwards, and this is my respiratory video assessment. So I'm going to start by looking at the patient's chest and assessing the rate of breathing. So I'm going to set a timer for 1 minute. Okay, so the rate for 1 minute was 20 breaths per minute. She had a regular depth, and there was no increased work of effort on breathing. The chest is symmetric, and there was no use of accessory muscles and no retractions, and there was no audible wheezing. So now I'm going to look for cyanosis, just looking around the lips to see if there's any blueness. Can you smile for me? Gums are also pink and moist, and then I'm going to look at her nails, look for any clubbing, and then also testing capillary refill to see if it's less than 3 seconds, which it is. So then at this time, I'm going to take a look at her trachea, just making sure that it's midline. I'm going to palpate. Sorry, my hands are cold. And it is midline. There's no deviation noted. And then I'm looking at her thorax, just making sure it's symmetric. And then I'm going to be looking at her anterior and posterior AP diameter, which is both symmetric as well. I'm just going to palpate for tenderness. Just let me know if you have any tenderness. Any tenderness?
No.
And then I'm going to do the same on anterior. Any tenderness?
No.
Okay, so no tenderness was noted. All right, I'm going to have you take a deep breath and blow it out. And she had equal chest expansion. So next I'm going to test for tactile fremitus. So I'm going to start posteriorly, bilaterally putting my hands on her back and then having her say 99.
99, 99, 99, 99, 99.
Then I'm going to do the same thing anteriorly.
99, 99, 99.
No, there was no abnormalities noted. So next I'm going to do percussion. I'm going to start posteriorly and then work to the anterior. I'm going to have you take a deep breath. Go ahead. And there was no hyperresonance noted. So next I'm going to do diaphragmatic excursion, which is measuring the patient's expansion on the posterior side. So I'm going to have you take a deep breath in for me, and then I'm going to have you blow it out. I'm going to have you hold. Then I'm going to have you take a deep breath in and hold it. All right, and then we're going to do the same thing on the other side. Can you take a deep breath in and blow it out and hold it? And then I'm going to have you take a deep breath in and hold it. And diaphragmatic excursion was about 3 centimeters. So next I'm going to go ahead and auscultate. I'm going to start on the posterior and then move to the front. I'm just going to have you take a deep breath in every time you feel me move, okay? Okay. And there were no adventitious sounds heard. She had clear lung bases and clear loops. So next I'm going to, if she had a cough, I would have to do the post-tussive test at this time, but the patient does not have a cough. So next I'm going to check for consolidation by doing the bronchophony test. So the same thing, I'm going to be auscultating and then having the patient say Scooby-Doo. Go ahead.
Scooby-Doo. 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 Scooby-Doo.
And then I'm going to be doing the egophony test. So I'm going to have the patient say E. I'll be listening for an A sound, which would indicate consolidation.
E. 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 E.
And then next would be the whispered pectriloquy test. So I'm going to have you choose whatever word you want, and then you're just going to whisper it every time you feel my stethoscope move, okay?
Okay. Box. 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 Box.
And there was no abnormalities heard on either one of those tests, so there's no consolidation on the patient. And that's all.